So when it comes to steroids, we're going to be talking about steroids in several of the different chapters. But in addition to Addison's disease, to replace the cortisol the body's not making, we also use glucocorticoids to reduce inflammation in any kind of allergic or inflammatory response. And many times steroids are given to people with blood dyscrasias and malignancies. When it comes to the adverse reactions of these steroids, it's important to know that fludrocortisone can cause congestive heart failure, so you have to watch out for that. And when it comes to just the glucocorticoids, there are just a ton of side effects. This says see back page of PowerPoint, and I printed the chapter 16 PowerPoints and forgot the side effect list with the steroids, but I will put that online. So it would behoove you to know some of these side effects. When it comes to drugs that interact with steroids, taking steroids can increase the effects on the body of barbiturates and sedatives, narcotics, and very much so anticoagulants, especially Coumadin. They can make all of these work more. So you're going to have increased central nervous system suppression. You're going to have increased bleeding risks. When it comes to taking steroids and using insulin, you're going to decrease the effects of the insulin and the oral diabetic drugs because steroids always raise blood sugar. So in people who are diabetics, you really have to closely watch their blood sugar. Even in people who are not diabetics, their blood sugar is going to go up. So any medications that you are taking for diabetes are probably going to have to be increased. Coumadin, I had included Coumadin as an anticoagulant that will have its effect increased, but I'm wrong. It's other anticoagulants. Coumadin will have its effects decreased. So you won't have increased bleeding time. You actually could clot when you don't want to. But other anticoagulants, your bleeding time, your risk of bleeding too much increase. Isoniazid, which is an antibiotic that's often used for TB and other really serious bacterial infections, that effect will be decreased. Aspirins and a lot of the broad spectrum antibiotics are not going to work as well when you're taking corticosteroids. Let's talk about adrenal gland hyperfunction when you are making too many steroids, too much aldosterone. You end up with a condition called Cushing's syndrome. And we all know the kind of the classic look of somebody who is on steroids. And you can see they give you the physical characteristics of somebody with too many steroids in their system. Their face will be flushed. Sometimes they'll break out with acne. They will gain weight, have a lot of water retention. They'll gain a lot of weight in their midsection and in their back, what's known as a buffalo hump. Not too flattering, but that's what it's called. While the muscles of the arms and legs will be very wasted. And so this is referred to as a Cushingoid appearance because of Cushing's syndrome and having too much cortisol. Hyperaldosteronism is when you put out too much aldosterone. The main cause of both of these problems, it's usually going to be a tumor on the adrenal gland that is making the adrenals produce too much. Generally, they're going to treat it with surgery and just take out the tumor or the whole adrenal gland if needed. If the surgery cannot be done, they'll try to control it with medication, although it's pretty iffy. On page 299, table 16, use 2, table 16.2, you see a couple of the drugs that might be given. One is a drug called mifepristone or Korlym. And this is a steroid blocker that's really the only one that can be taken by people who have both diabetes type 2 and hypercortisolism. So if you're making too much cortisol plus you have type 2 diabetes, then this Korlym is the one that's recommended. They also have a drug called Lysidren or Mitotane that cuts down on steroid production. So these drugs can be effective if the person cannot have surgery for some reason, but most of the time Cushing syndrome is going to be caused by a tumor that needs to be removed. On page 299, there's patient and family teaching. This person is going to require very, very frequent lab checks, or very regular lab checks, frequently at first, and then as they remain on the medication on a regular schedule. So here's the cartoon that I had showed you before. There is something called a pituitary adenoma, which is a tumor on the pituitary gland that causes Cushing syndrome or Cushingoid appearance. You can have a tumor on the adrenal gland, and then sometimes you'll have iatrogenic Cushingoid appearance or Cushing syndrome by taking the steroids. Always very, very important never to stop taking steroids abruptly. Even if you are just taking them for a few days for some kind of a respiratory infection or something like that, the body knows that it's getting extra steroids, and so it will actually cut down on its production of cortisol in your body when you're taking steroids for an immune system issue or an allergy. And so it's going to throw your body into shock or some kind of a bad state to abruptly stop. You can have a rebound production of steroids. So that's why when you take one of those Medrol dose packs or prednisone for upper respiratory infection or allergies, you start with 10 or 6, and then you gradually cut down until you're just taking one a day, because you always have to be weaned off very carefully. All right, we'll stop here and get back to the discussion with talking about male and female hormones.